Hi there. In this lesson, we are going to focus on some various mechanisms of cellular injury and then talk about some examples that relate to them in this pathophysiology lecture number 3. So on that note, first what we'll do is we'll spend a little bit of time talking about various types of cellular injury and then differentiating between a couple of very important types of cellular injury that you're going to run into from time to time. And then we need to talk about basically cellular manifestations of injury. So when injury occurs, what happens? Like what are the morphological or physical changes to cells that we see when they're injured? And then I'm really not going to focus on cell death in this particular presentation. I'm going to save that for the next one. But this is, but basically these two topics here are the main ones we're going to focus on. All right. So let's just spend some time talking about just some basics of cellular injury. Now remember that when you're taking pathophysiology, you're learning about you're thinking about these diseases and the organ systems and the organs that are affected by these various diseases, but you have to remember that you kind of have to go back to that organs, tissues. They're composed of cells. All right, so you have to remember that that when cells are injured, that's going to affect the appearance and functionality of the tissues that make up the organs. So that's why we take it all the way down to this level. All right, and so basically, when we're talking about reversible versus irreversible injuries, it's gonna go all the way down to the cellular level. All right, because if the injuries are reversible at the cellular level, that obviously more than likely means that the tissue and the organ itself can be preserved. Whereas if they are irreversible, well, vice versa. All right, so it's something you have to bear in mind that when we're talking about these reversible and irreversible injuries, we're going all the way down to the cellular level. This really doesn't need a ton of explanation on its own, because you can understand that reversible injuries mean that if a cell or tissue is injured or damaged, that we can return that tissue to its normal function, whether it's on its own or through medical intervention. That tissue can recover, right? Whereas if it's irreversible damage, that's it. An example that would be the heart, all right, or the brain. All right, mainly because the cells that the primary functional cells, the myocytes of the heart and the neurons of the brain are incapable of undergoing mitosis. So if we destroy cells in those particular organs, that's going to be irreversible damage. We can't regenerate that new tissue. That tissue will be replaced by scar tissue because of the mechanisms of inflammation, or well, at least the heart will anyways. The brain will just more or less be kind of left with a cavity, all right, because there is no connective tissue in the brain. All right, but you understand the basic concept here. Now, obviously, this is also bad because with irreversible injuries, that means that organ is not going to be as effective as it used to be. Versus, with a reversible injury, there's the chance of potentially fully restoring that organ. Now, that's not always the case, but there's the potential depending on the extent of the damage and so on. All right, so then here are just various agents of that can damage cells and tissues and organs. All right, the two main ones we're going to focus on in this presentation are going to be hypoxic and chemical. So right now, before I move on, I just want to spend a little time giving some various examples of these last, or just talking about these last four. I'm not going into depth with these right now, just because. We'll hit on these as we go. In a couple of weeks, we'll be talking about the immune system and infections and the immune response. So, we'll talk about that a lot more. But even in the very next presentation, we talk about cell death. We'll talk about gas gangrene, and we'll talk about basically how the Clostridium bacteria can cause severe damage to the tissues that they invade. The muscle tissues, they come in through a cut, and then various systemic damage as well. All right, so infections can cause reversible or irreversible damage. like for example, gas gangrene more than likely is going to be irreversible, just due to the extent of the damage it's going to cause. And not always, but it can. Obviously, the longer you leave it without treating it, the worse it's going to get, because oftentimes gas gangrene leads to amputation. All right. Whereas, I mean, if you've probably more than likely had a simple cut on your skin and just had a minor infection in there before, and have treated it and it's gone away, so we've all dealt with at some point in time some kind of reversible damage. Anybody that's survived the flu, all right, anybody that's gotten sick, that survived the flu, has had some cellular damage as a result of that. But obviously we're still here. All right, so infections are just caused by microbes, which are obviously a form of a pathogen that can damage us. But like I said, sometimes we can clear them out on our own via our immune system. Sometimes we need medical intervention, but they can obviously cause both reversible and irreversible damage. All right, genetic disorders. There's a wide array of these. Ranging. Like for example, one of the, like Huntington's disease. Huntington's disease, that's a degenerative disorder of the brain, where literally the brain basically just falls apart. And that's obviously been isolated to a particular gene. That's obviously going to cause irreversible damage. Or if we're thinking of sickle cell anemia, depending on the form of it, not every person with sickle cell anemia, is going to have an overly dire life or diagnosis, but it obviously can complicate life. And obviously, in the more severe forms of it, it's bad to live with. But again, we're talking basically, irreversible, or at least, manageable cell damage there. All right. So those are just a couple examples of many different genetic disorders. And like I said, as we go throughout this, especially once we start really getting into the organ systems, I mean, we'll run into examples of genetic disorders out there that cause harm to our tissues. More often than not, genetic disorders are going to be, irreversible. So I mean, because we're talking, ingrained in the genetic code of tissues. So they're hard to combat. Most of the time with genetic disorders, we're not necessarily curing them. We're spending most of our time just managing the symptoms, and managing the disease itself. So, excuse me. So that's something you have to keep in mind. Nutritional deficits can cause issues. Basically, whether it's someone has a GI disorder, where you're, a malabsorption problem. Someone has cancer and they are wasting away because that cancer is basically gobbling up all the nutrients in the blood and the oxygen, and so on. All right, so again, nutritional deficits can come here and there, or a kwashiorkor. Pardon me if I said that incorrectly. I always thought I was saying that correctly till I had a student from Nigeria once who, bless her heart, laughed her butt off the first time she heard me said it, corrected me. Apparently, I can never say it right, but again, that's an example of a disorder where young children tend to not take in enough calories, and especially fats and proteins, and that causes a reduction in albumin, and so on, causes severe edema, causes some muscle wasting of the extremities, can be very fixable, obviously if you just, get calories and protein into the children. All right, so again, nutritional disorders can range from both. Physical, I mean, this is definitely the easiest one to think of examples with when you're thinking of physical injuries. We've all experienced a physical injury at some point in time. If you've ever, even something as minor as just getting, hit or punched, and you have a bruise, I mean, that's an example of a physical injury. Then obviously, as we get more extreme, with stabbings, gunshot wounds, sports injuries, work-related injuries, like let's say you're a roofer and you fall off of a roof and injure yourself. I mean, that's an example of a physical injury. All right, and again, I mean, you don't need me to sit here and really tell you that the damage from this can be reversible or irreversible depending on the extent of the damage, what organs are damaged, the tissues, and so on. All right, all right, so so those are just some basic examples, and like I said, we will give more specific examples as we kind of go throughout this lecture series. That's why I'm not really going to focus on these too hard right now in this particular video presentation. But for now, I think it's important that you as a student just need to understand that these are forms of injury that can cause either reversible or irreversible damage to organs and tissues. All right, so let's talk about hypoxia. All right, hypoxia. Now, first off, it's very easy as a student to confuse hypoxia and ischemia because they are relatively similar. Hypoxia is more of a general or kind of a vague term. I don't want to downplay hypoxia and make it sound like it's a minor thing. It's just that hypoxia is just a lot more general because literally if we're talking about hypoxia, we're just saying a general lack of oxygen, which can be caused, ranging from cardiovascular to respiratory disorders to edema to complications of diabetes, you name it. So that's basically hypoxia, choking. All right, basically, and so obviously that's causing a lack of oxygen just a lot more rapidly. So you get the picture. So just in general, when you see this term hypoxia, you need to think a lack of oxygen. All right. Now, if we're saying ischemia, all right, ischemia. What this is a form of hypoxia, but it's a lot more specific. All right, so this is a lot more specific. So what we're saying here is that tissues, cells, organs are being deprived of oxygen due to a lack of blood flow. All right, a lack of blood flow. And most often, most of the time when we're thinking about ischemia, if we think this is a blood vessel here, we're thinking that there's some kind of a blockage inside of that vessel and blood flow is being obstructed to that tissue. All right, so that's hands down the most common form of ischemia out there. We're going to see blockages in vessels. All right, and obviously when this occurs, this is especially when we're at 100% blockage. This is obviously going to be very severe because that means that tissue, the cells that are in the tissues of that organ are going to be rapidly deprived of oxygen and are going to be very rapidly injured, and it's going to cause a massive injury depending on A, the extent of the ischemia, and B, how quickly we catch it, and C, how quickly we can reverse it. All right. So and something you have to keep in mind is that ischemia is the most common form of hypoxia. Okay. Ischemia is hands down the most common form of hypoxia, all right? And a lot of it has to do with just the complications of, the cardiovascular system, pulmonary system, and as to how we age, and so on. More in the cardiovascular system, I should say. But, so it's something you have to keep in mind. Ischemia is hands down the most common form of hypoxia, all right? Other forms of hypoxic injury could be from anoxia, an overall lack of oxygen. All right, because remember, whenever you see the letter A in front of a word, that means without. The reason why it's an here because we've got a combining. We've basically got basically in medical terminology. You don't take a prefix and you don't take a word root, and they both begin with vowels and put them together. All right, so. That's why the N is there. All right. So normally when you see the letter A in front of a word, that means without. But this is a special situation where we have anoxia. It has the exact same meaning. All right. And that's the rule of that right there. All right. Now, other causes could be a loss of hemoglobin, all right, of hypoxia, and, anemia comes to mind whenever I think of this example. Remember, anemia is kind of a general class of red blood cell disorders that have various causes. If we think of iron deficiency anemia, that's due to a lack of iron. There's pernicious anemia. There's the hemolytic anemias like your sickle cell. All right, all of those, basically, and there's various other examples as well. But when we're thinking of anemia, basically we're talking about problems with red blood cells. All right, RBCs. And that red blood cells, their main job is to circulate oxygen and carbon dioxide in a specific form, carbonic acid. All right. But you get the picture here, especially when we have problems with hemoglobin. Basically when we have problems with hemoglobin, that is going to cause a reduction in our oxygen carrying capacity and cause things like fatigue. You'll see skin, start to dry up and get flaky, and so on. All right, so hemoglobin can cause this. Reduced functionality of hemoglobin. All right, whoops, as I draw a line clean through it. Like you're again. Like sickle cell anemia would kind of goes in between both of these, all right, because the hemoglobin is present, but it doesn't function properly, all right. Severe metabolic acidosis or alkalosis, very severe temperature changes within the body, because you remember your oxyhemoglobin dissociation curve, all right. If we have severe pH or temperature changes, that's going to reduce the functionality of hemoglobin, all right. Respiratory and cardiovascular diseases. Obviously, if we have respiratory complications, we're going to have a hard time getting oxygen into our system and simultaneously CO2 out. Cardiovascular complications. If we have a hard time pumping or circulating these gases around the body, you can do the math there. Poisoning, like cyanide poisoning, basically reduces mitochondria's ability to take in oxygen and utilize it to make ATP, which causes, people, they tend to get this very red, cherry red appearances, like you can see it in their face very, very easily, and obviously if the mitochondria are rapidly deprived of oxygen and can't make ATP, well, the cells are also going to rapidly die. All right, but the key, so in general, basically hypoxia, a lack of oxygen. Ischemia is the most common and a very specific form of this, a lack of oxygen due to a lack of blood flow. All right. Now, when cells are injured, and especially in situations like hypoxia that we're seeing here, all right, cells tend to take on specific morphological changes. All right, so basically what will happen, so one thing you have to bear in mind is when we're thinking about cells, you have to remember those sodium-potassium pumps. Sodium, potassium, ATP, A's. All right, remember, whenever you see A's on the end of a word, you think an enzyme of some sort. All right, you have to remember that these are cellular pumps that are pumping out simultaneously 3 sodium ions out of the cell and 2 potassium ions in. All right, I should probably put the arrow in there. There we go. All right, and typically whenever you see a symbol drawn like this, a circle with, arrows moving like this, we're typically talking about a pump of some sort. All right. Now, when we think about this here, this injury that we're seeing here, so if we become hypoxic, now you have to remember that this is a form of active transport. All right, so this is a form of active transport. So therefore, this is going to require the expenditure of ATP. All right, because you know that the vast majority of the body's sodium is found in the extracellular fluid, whereas the majority of the body's potassium is located in the intracellular fluid. All right, and there's the main reason why we create this very unequal balance of these two electrolytes in the external and internal environments of the cell is for the purpose of osmosis. All right, we're trying to maintain. Basically, what we're trying to do is we're trying to maintain. Basically even osmotic pressures or forces here, because remember these solutes, when we're talking about osmosis, you have to remember that water is drawn to areas where there's a higher concentration of solutes, pending there's a membrane that's permeable to the water. All right, obviously the cell membrane is qualifies as that. So so then what we have here then is if a cell is becoming hypoxic, well then you can probably start to guess as to what's going to happen here. All right, we're gonna have a reduction in ATP production. All right, all right, so then what's going to happen is that's going to cause the cell to swell. All right, because if these pumps aren't getting the ATP that they need, to create this balance, this uneven balance of sodium outside and potassium inside. All right, what we're going to start to see is basically we're going to see an uneven balance between these osmotic forces. So and then that balance is going to shift and to favor the influx of water into cells. All right, so basically these cells are going to start to accumulate with more sodium, and this could cause, and that's going to cause some more potassium to leak out, because severe hypoxia and ischemia can actually cause hyperkalemia, excessive potassium in the system. All right, if it's not corrected quickly enough. All right, but the real thing to look at here is basically the first step in these hypoxic injuries to cells is that they are going to swell due to a reduced functionality of the sodium potassium pumps. Now, bear with me here for a sec. So that's number one. The cells are going to swell. All right. Now, as the cells swell, that's going to affect the organelles of the cell. All right, that's going to affect the organelles of the cell. Now, some of the things you're going to see with cellular swelling here is that's basically going to cause the endoplasmic reticulum to dilate. So the endoplasmic reticulum is going to kind of swell up and, well, not kind of, it's going to swell up and dilate. And especially when we're thinking about the rough ER, the rough endoplasmic reticulum, as these membranes swell, that's also going to cause ribosomal detachment. Okay, so those are supposed to be ribosomes. All right, so it's going to cause the ribosomes to detach. All right, it's going to cause the mitochondria. So let's say here's a normal looking mitochondria. All right, the mitochondria is going to swell as well. All right, mitochondria are going to swell. The cytoskeleton is going to start to, this could damage the cytoskeleton and cause it to start, and cause these proteins to start breaking off and aggregating or clumping together. All right, it's going to cause the cell membrane to basically bleb outward. All right, because remember the cell membrane has a very fluid, functionality to it. It's able to kind of fluctuate in its watery environment. So you're going to see, the membrane blebbing out. All right. So basically, the common theme that you're seeing here with this is basically accumulation of water. Basically these organelles are going to swell, ribosomal detachment, protein, like cytoskeletal proteins aggregating together, and pretty much this is due to a drop in ATP, due to the drop in oxygen. All right, because of the hypoxia. Now, all of these changes that I just talked about right here and described are reversible. Okay, these are reversible changes. Now, all right, so obviously how do we reverse this? Well, it should be pretty simple. We need to get more ATP going, all right, into there. So if someone has a respiratory condition, like you see a lot of people out there who have emphysema, chronic pulmonary disorders, wearing oxygen masks to make sure they get enough oxygen in their system. If someone has an occluded vessel, cleaning up that the occlusion in that vessel. I mean, you get the picture. If someone has severe edema, figuring out what's causing the edema, obviously try to remove that complication, and so on. All right, now these are all reversible changes. Now these changes start to become irreversible when the cell membrane gets involved. All right. So, I mean, while this is happening, the cell membrane is slowly going to start to, become damaged as well, and the membrane could potentially start breaking apart. Now, the problem that we're going to see here is with calcium. All right, there's normally no free calcium inside of the cell membrane, or inside of the cell itself. All right, so there's usually very little extracellular calcium anyway. But if you have none in the cell, any amount outside of the cell is going to cause an influx if we, create the right opportunity. And this would be the right opportunity. Now, the problem here, what we're going to see, is that as calcium, as calcium starts to diffuse into the cell, as the cell membrane breaks apart, all right, that's going to start to activate various enzymes. For example, we could activate various lipases. lipase. Sorry, it's supposed to be an S. All right. So we could start activating lipases, and these lipases could start breaking down or digesting the cell membrane. These fat degrading enzymes. All right. This could cause various proteases and cause the breakdown of proteins and organelles inside of the cell. All right. That's bad. And then what's going to happen is that calcium is going to get into the mitochondria and cause calcification of the mitochondria, which essentially shuts them down. All right, and then as we shut the mitochondria down, you can do the math. The cell itself is going to die. So basically, when we get to the irreversible side of damage, that's when the cell membrane starts to degrade and fall apart, and then we have a massive influx of calcium inside the cell. All right. Now, when the swelling initially takes place, there will be a little bit of stored calcium that'll be released from these swollen organs that'll cause, just very minor complications here. All right. But like I said, when the membrane breaks open and this calcium really starts to work its way in, that's where the real damage occurs. All right. And then obviously, once this membrane is broken down enough, then the damage is irreversible and the cell is lost. All right. And that's and then And in explaining this is something that always kind of annoyed me a little bit. Textbooks like to say that cells burst. They fill up with water, they burst, they pop. Cells are not water balloons, all right? They don't fill up with water and just burst, all right? They fill up with water and specifically go through these changes, all right? Like for example, when you're first learning about tonicity and you're talking about cells in a hypotonic environment, that's when classically books like to say cells. Many books like to say they burst or explode. I've even seen that used before. They don't do that, all right? By the time you see a cell under a microscope and it looks like it's exploded where the membrane is broken apart, all right, it's leaking out all these various proteins and enzymes out into the system, all right, that cell has been dead. It's been long gone, all right? So even though it may have looked like it exploded, it didn't, all right? So, now, one of the things you have to think about as well with this is as this membrane breaks apart and as this membrane falls apart, what's going to happen is that's going to cause some various proteins to leak out of the cell. All right. Now, this is basically when a lot of these proteins or materials that leak out of cells we use as indicators. We can call them indicators. Again, pardon my horrific handwriting here. I'm trying to adapt to using this new bamboo tablet here. All right, indicators or markers. Like, for example, I'm just going to abbreviate this, troponin A1. Troponin A1. It's a very common marker. So let's say a patient comes in and the patient comes in the emergency room and they're complaining of severe chest pain, and you could run a blood test real quick and then check their blood, and if you find troponin A1 in there, remember troponin is a regulatory protein found in the sarcomeres of muscles, all right, and specifically in these cardiac muscle cells. So normally there is zero troponin A1 in the bloodstream. Now, if you see this protein start to leak out and accumulate in the bloodstream, that's typically an indicator that, okay, well, we have cellular damage here. All right, we have cellular damage here. So this could indicate that, okay, this person not only this person is not only having an ischemic heart, they could be in the midst of having a mild heart attack. All right, so you get the picture. And what's the word for chest pain? Remember the word for chest pain? Blasted thing. Angina, not angina. Drives me nuts when people say angina. Angina. All right. So when people, so that's the proper term for chest pain. All right. So that's something you have to keep in mind. And then, like I said, various other organs and cells and tissues leak out these various indicators or markers as their cells die as well. I mean, when you're running liver function tests, this is what that's what you're looking for, is as these liver cells die, these markers and indicators that are being leaked out into the system. All right. Now, the extent of how quickly it takes to get to this point, to the reversible side of injury, to getting irreversible, depends on the tissue we're talking about, depends on how hypoxic it is. If we're getting to the point of ischemia, where blood flow is basically, dramatically reduced or cut off, like I said, due to a clot or a compressed vessel, that you're going to see these changes occur. These changes are going to happen very, very rapidly. All right, someone is if a clot or a fatty embolus gets stuck in a vessel in the brain, and a person's stroking out, having a stroke, these changes are going to occur very, very rapidly. All right, so you get the picture. So these are typically the stereotypical changes in a cell. With morphological changes with hypoxic injuries, how quickly it takes to get to this point depends on the severity of the hypoxia itself. All right, and in talking about this ischemia, this kind of leads me to think about another example of an injury that can occur that's related to this, is reperfusion injury. All right, so let's say we've got a vessel here, and this vessel is occluded, it's blocked. It's blocked. So then, let's say this is what a cell would look like normally, and then under the hypoxic conditions, it's going to start to swell. Again, we got the nucleus, ribosomes detaching, ER swelling, membrane blebbing, yada yada. All right, you get the picture here. So now, like I said, how quickly we can reverse this depends on, again, how quickly we can get to this block. All right, sometimes if someone comes into to the ER with chest pain, as long as they're not stubborn about it and didn't wait a week until after they start experiencing chest pain, you can dramatically reduce the amount of damage that the heart will incur. If you wait a week or so, of just persistent chest pain, then the chances of having a more fatal heart attack obviously are going to be a lot worse. And you get the same with the brain. If someone is showing signs of a stroke, the TIAs and memory loss and other signs, because not everyone just goes into straight up, having a heart attack or going into a stroke. If someone having a big stroke, oftentimes with these types of injuries, there are subtle signs and symptoms that lead up to it. So pay attention to those. All right, but basically, what's going to happen here is when when blood flow is occluded to an organ, you understand the type of the type of cellular manifestations that are going to occur with this. Now, what can happen is that some of these cells are probably going to die in this situation. All right, and then as these cells die and break apart, what's going to happen is they're going to release these metabolites. All right, primarily anaerobic metabolites, because they're metabolically they're living with they're living on not having oxygen, and then basically they're going to via anaerobic metabolism, try to sustain their life, keep themselves alive, but they're not going to be able to do that for very long. So then you're going to have a lot of these metabolites, byproducts of anaerobic metabolism released, and so on. All right. So, and then what's going to happen is as the tissue accumulates with these metabolites, then what happens if we reintroduce blood? If we remove that blockage and get blood back into there, well, now all of a sudden we're going to have a massive influx of oxygen into the tissue. All right. Now, that massive influx of oxygen then is going to cause a dramatic increase in the generation of free radicals. Those reactive oxygen species or agents that we like to think of. So basically, these are very unstable compounds, primarily oxygen-based compounds. That they're missing an electron, and in order to make themselves, in order for them to balance their own equations, they react with other, with other molecules inside of cells and tissues. Now, the problem with this here is as we generate these free radicals, as we have a massive increase of these free radicals, these are going to cause cellular damage. All right, further, let me take that back. They're going to cause further cellular damage. And free radicals extensively, when we take a look at a cell, free radicals especially damage enzymes, DNA, and mitochondria. Whoa, whoops. Oh, god dang it. Sorry about that, people. Or folks. Accidentally press the button. So how do I have this? Reintroduce blood flow. Increase in free. I'm just going to abbreviate this. Free rads. Then we'll go increase damage. Alright, because as we reintroduce blood flow, that's going to increase oxygen. Alright. And then I was in the middle of drawing a cell here. All right, so So again, I was saying that that's going to cause that free radicals primarily damage enzymes, DNA, and mitochondria. All very pivotal to the cell. You know, the metabolic enzymes that drive cellular function. I think by now you all know how important DNA and mitochondria are to cells. All right. Plus, free radicals tend to damage membranes, you know, because typically with mitochondria, that's what's damaged, are the membranes of the mitochondria, and those free radicals also cause damage to cell membranes. So the point I'm making here is, as we flood this already damaged tissue with more oxygen and generate a ton of free radicals in this, that's going to cause further cellular damage and further death of tissue. It could increase the cell death within the tissue and obviously further the damaging effects of the tissue. So that is a potential complication that can occur just with doing the right thing, just by reintroducing blood flow into an organ. That's why it's called a reperfusion injury. All right, reperfusion. Because remember, when we're talking about perfusion, all right, the difference between, when we're thinking of blood flow is a lot more general. We're basically talking about how much blood is being circulated over a particular area over a given unit of time. All right, like 5 liters of blood is circulated through your heart, or your entire body, I should say, your cardiac output, all right, every minute. All right. Whereas with perfusion's a lot more specific. We're talking about the amount of blood being circulated into a particular mass of tissue. Otherwise, we're saying how much blood does this particular organ get. So, for example, 25% of your cardiac output goes to your kidneys. All right. So, on average, 1.25 liters of blood. Just abbreviate blood goes to your kidneys every minute. All right, so you see the difference here. So that's why this is called a reperfusion injury. We're restoring blood flow to that specific tissue. So this can potentially be a problem. And the organs that tend to be the most susceptible to this are the brain, the heart, and the kidneys. All right, the brain, the heart, and the kidneys. Now, this doesn't happen every single time we restore blood flow to these tissues, but the chances of it happening are there. All right, and can you really predict this? I mean, I don't know. Can you? I mean, not really. I mean, obviously, it depends on the extent of the damage. Obviously, the longer they were ischemic, obviously the longer that tissue was ischemic and the more cell death that occurred, obviously the increase in chances for reperfusion injury. All right. So you get the picture there, which can obviously, so if someone has a stroke, this causes further damage, of the brain, especially, a prolonged stroke, same thing with the heart and the kidneys. All right. So this can cause even yet more damage to the organs. And this is why, if there is reperfusion injury, a lot of, what they'll do is, one of the things they'll do to try to treat this is pump the person full of antioxidants. All right, there's other treatments out there as well, but this is just really the one I'm going to leave you with, antioxidants. All right, these are compounds that are used to combat free radicals. We have enzymes that normally, because we normally generate free radicals on a daily basis, just from just the metabolic activities of our cells. Coming in contact with ionizing radiation like sunlight, if you eat foods that tend to have a lot of chemicals in them, that can cause the generation of free radicals and so on. So antioxidants are used to combat that. So that's reperfusion injury, and I just wanted to talk a little bit about that as well, because that's something you may potentially run into. And my apologies on deleting that picture there. All right, so some other injuries that can occur due to a lack of oxygen would be injuries that are called asphyxial injuries or asphyxiation. All right, so and again, this could be the asphyxiation can be hypoxic or it could be anoxic. Basically this could be just a reduced amount of oxygen or just boom, fall out, no oxygen. And obviously it depends on the situation here. Geez, I'm going crazy with this thing today. Suffocation. So basically, if we say suffocation, what we're basically saying here is that oxygen is not reaching the blood. All right, oxygen is not reaching the blood. All right, a pillow over the face or being entrapped in an area where there is very little oxygen. When you think about, whenever when you think about the miners that are underground and the mine shaft caves in and then, they run out of oxygen. That's suffocation. All right, excuse me. Choking. Choking asphyxiation. I mean, obviously, this is when an object gets lodged and prevents, makes it difficult to breathe. Now, let's kind of think about this for a second here, because if we look at a person. So this is anterior, this is posterior. All right, it goes. I'm just going to abbreviate these: esophagus, trachea, and vertebrae. All right. So your esophagus is anterior to your trachea, and your trachea is anterior to your vertebral column. Now, when people choke, what happens is that you bite off more than you chew. You can chew, and you continue with the process. You swallow it, or a little kid, like you hear about this all the time, because when we're young children and growing up, we're curious about the world, and part of understanding the world is touching things, picking them up, and putting them in our mouths. So if a little kid swallows a marble, all right. So what happens here is when we choke is a large object goes down our esophagus, and then what happens is the esophagus presses against the trachea. All right, the esophagus presses against the trachea, and then, the trachea can't really adapt to this very well because you have a bony spinal column right behind it. So then what happens is as that trachea is compressed, well, you can do the math here, oxygen is not going to be getting in. All right, and the reason I say this because when someone is choking, because you have to remember that our trachea and our conducting airways in general are incredibly sensitive to irritants. All right, I mean, when you take a drink of something and we say, oh, I went down the wrong tube, and you cough and hack for 5 hours straight. You don't see a person who's choking coughing. They're out of they're running out of air. All right, so that's essentially how choking occurs. All right, and that's why when you do the Heimlich maneuver, when you do that, whether you're doing it to somebody, you stand behind them, take your thumb, stick it under their xiphoid process, and or if all fails, uppercut them. No, don't do that. I'm just kidding. Or if you're by yourself, you lean against a chair and force yourself against it. Because you're pressing on the stomach to basically increase the you're trying to force air up out of your stomach to obviously hit this lodged object and get it out, spit it out. Okay, so that's essentially how choking happens. All right, chemical. Basically, that would kind of be like the example I gave that example earlier. That would be your cyanide poisoning. All right, drowning. I mean, again, having a bunch of, filling up with water via drowning and strangulation. These are various forms of asphyxiation you're going to run into. And I just want to talk a little bit about the differences between these two. For example, hanging versus ligature. Especially if you're going to work in the emergency room or whatnot, you will see this from time to time. The vast majority of the time will be either suicide attempts, with the hanging, and with the ligature, murder, probably murder. Excuse me. So basically, with hanging, now you have to remember when someone hangs themselves, when they're hanged, and let's just get this out of the way right now. The only people that are potentially capable of being hung are males. All right. When people have an object tied around their neck and they're suspended from a ceiling or some other object, they are hanged. They are not hung. All right. So let's just get that out of the way right now. Say hanged. But when someone is hanged, now you have to remember they don't have to have their feet off the ground, and actually they have to be dangling from an object. I mean, when you hear about these examples of I hate to talk about this, but it's something that happens from time to time. Let's say you see a college kid in their dorm room where they tie like a necktie on the top part of their bunk bed in their dorm room, and then they, let's say they've had a few drinks as well, and they want to further the buzz. What they can do is they can, and again, please don't actually try this after I'm done talking about it. I'm not advocating for this at all. Don't do this because people die from it. is that they'll put their they'll loop their head through and then they'll lean forward, while obviously on their knees, and then lean forward and then press it, then let's say that necktie squeezes their neck, and then it cuts airflow off to the brain. I should say blood flow to the brain, because you compress the carotid arteries, and airflow to the brain cuts blood flow off to the brain, and then what happens is and then if you pull away quick enough, your buzz is going to get even higher, because your brain didn't get enough oxygen. And obviously, if you don't pick yourself up right away, you're going to pass out. You're going to pass out while having your head in a homemade noose, and it's going to kill you. So that does happen from time to time, and for heaven's sakes, do not do that. All right. But like I said, that's something, if you work in the emergency room type setting and you're in a college town, you may see that. All right. Whereas ligature, this is where someone is basically strangled with an object, like the infamous mafia and the piano wire kind of an example, things like that. All right. Now, the reason why I'm bringing this up, because from a pathology perspective, the scarring is going to be slightly different with this. So let's say here's someone's neck, and if someone is hanged, oftentimes what you'll see is a V-shaped scar, because because as their head leans forward or leans down from this, the rope is going to pull kind of at an upward angle on their neck, and that's the type of scarring you'll see. Versus when you see the ligature scarring, it could be parallel with the neck, or it may be at a slightly upward angle depending on how the person was strangled. But something you have to keep in mind is the scarring on the neck is going to be a little different between these two as well. And then manual strangulation is basically, someone's getting strangled, and then they get their hands on their throat. They're trying to fight it. They're trying to fight it. This from someone else's hands on their throat, squeezing. Because manual, you think of manual, you're thinking, using your hands, and then a person is choked like that. Now, I know that sounds horrible and morbid to talk about, but these are injuries that you are going to run into, especially if you, like I said, if you want to work in an emergency or trauma type setting. All right, but again, all these are examples. These asphyxiations are examples of oxygen either not getting to, primarily when you look at these, oxygen not getting to the blood. All right, because pretty much all these are examples of suffocation. All right. Well, that was horribly depressing. Let's move on to the next topic. Chemical injury. Chemical injury. Now, you have to remember, when it comes to chemical injury, there are a wide array of various chemicals that can do us harm. Ranging from preservatives in food, ranging from poisons, coming from medications that we take and how we react to them, or overdosing on medications, exposure to pollutants, exposure to chemicals on your job, drinking water. I mean, you name it. We could sit here for a while and name all these various different chemicals and means of exposure. All right. Now, one thing you have to kind of remember about a lot of chemicals, there's a lot of chemicals that aren't really harmful to us until they're actually introduced into our body. All right, so that's something you have to remember about many chemicals, is that we biologically activate them. Not all of them, but many of them once they get introduced, and then they cause us harm. All right, and like I said, how these chemicals get into us really depends on the on the type of chemical and where it's found, and how it affects us as well. If it's in drinking water, the soil, if we inhale it, if it's a medication ordeal. All right, you get the picture. Now, when it comes to methods of injury, direct damage, some chemicals can just directly damage cells and tissues. Like acids, ingesting chemicals, like there's a reason why the warning labels are on all those, bottles of chemicals. Like when you think of like a little kid, if they accidentally get their hands on a bottle of bleach and drink it, all right, that's going to cause some very severe damage. All right. Basically, if we think of an exaggerated response, this is something you're going to see a lot, especially with medications. All right, and not just medications, but oftentimes with overdose. Okay, with overdose, if we overdose on a particular medication, or if the medication accumulates in the system, because you have to remember part of pharmacology is and pharmacokinetics and so on is metabolizing, utilizing the drug, and then clearing it out of the system. All right, and if for some reason that drug is not clearing out of the system, well, you can do the math. That can do us harm. All right, again, the biologic activation of various toxins or poisons or so on. Like for example, free radicals. Oops. All right, when you think of, I kind of tend to make it a rule of thumb. I tend to not buy meat that is not refrigerated. Because obviously, back in the day, meat used to be preserved just by dehydrating the daylights out of it by, putting a bunch of salt in it, like straight up salt, dehydrating the meat, and then you get your jerky, your preserved meat from that. Nowadays, it's, those nitrites and so on, those nitrate-based preservatives. And the problem is those alone are not harmful to us, but when we ingest them and we metabolize them, then we convert them into nitrosamines, then those do us harm, and especially they tend to do a lot of harm to the walls of the colon. And so on. So that's something you have to bear in mind. Is that in those a lot of those nitrate-based preservatives aren't harmful until we ingest them and metabolize them. All right, and then another example could be a hypersensitivity to a chemical, which is basically an allergic response. All right, which could obviously cause anaphylaxis. If you're taking an antibiotic and you have an allergic reaction to it, a food allergy, an allergy to a perfume, some kind of chemical, because there's a reason why when you're going into medicine, especially when you're getting more in depth with your classes, you're doing your clinical rotations, you're not allowed to wear stinky stuff, perfume or cologne, because people can have allergic responses to those. Okay. A couple specific examples of chemicals and poisons that I want to talk about. One was carbon monoxide. All right, carbon monoxide is a colorless, odorless gas that affects red blood cells. All right, and more specifically, the hemoglobin on the red blood cells. All right, now carbon monoxide, how we are exposed to it. It varies depending on the situation. Exposure could come from smoking. If you directly if you directly inhale smoke, you're going to take in carbon monoxide. All right, and obviously a first-hand smoker is going to be more susceptible to this because they are taking it straight in. I'm not sitting here saying secondhand smoke is good for your health, but I think we overhype it a little bit as to how dangerous it really is. Again, I'm not saying you're saying that it's not good. I'm not saying it's good for you. I'm just saying that I think we're a little too oversensitive about secondhand smoke. So smoking, could be occupational or a work hazard. If you're working around where you're burning a lot of materials and you're inhaling it, could come from the home. Furnaces. So pretty much almost anything you burn, you're going to generate carbon monoxide, because basically CO, all right, carbon monoxide versus the thing that we always think about, carbon dioxide with 2 oxygens. All right, so typically we form, whenever you burn something, all right, you're going to emit carbon. All right. As you burn, and especially, let me take that back. When you burn something organic. Okay, because remember, anything organic is composed of carbon. All right, and remember, when you hear the word organic, you should think carbon containing and the rip-off section of the grocery store. But for this sake, carbon containing. All right, and so basically, and then as we emit this carbon, the carbon's going to mix with oxygen that's in the air, and as long as there's an ample supply of oxygen, we'll just form a relatively harmless carbon dioxide. All right, but if there is a deficit in oxygen, will form carbon monoxide. Now, obviously, there's going to be, as the carbon is emitted, and so let's say we've got some wood here, we've got a fire going here. All right, as carbon is emitted, you're going to form carbon monoxide very near to where the burning is, because closest to the fire, obviously that fire is consuming all the nearby oxygen. All right, and then as this carbon monoxide goes out, it could mix with other other oxygens and form carbon dioxide. All right. So even if you're sitting really close to a campfire, there's a chance you're breathing in a little bit of carbon monoxide. All right, but just a little bit. It's not going to really harm you at all. That's why, especially because I live in the upper Midwest of the United States. I'm from Wisconsin originally. I live in Minnesota now. What happens here is so you used to see a lot of deaths with carbon monoxide and furnaces and heaters. So especially with these, especially with a lot of gas furnaces and so on. So basically, if you crank up your fuel intake into the furnace and you don't simultaneously crank up the air intake on the furnace, what's going to happen is that furnace is going to burn hotter and heat the house. But the problem is you're not going to have enough air coming into that to match the increased fuel burn, and you're going to pump out more carbon monoxide, and then obviously that's how a lot of people were found dead in their homes. Um, or when someone's working on a car in their garage. You don't really see this anymore nowadays because cars don't really have cars that are made nowadays don't have carburetors anymore. But if you're working on an older car in the garage that has a carburetor and you're dinking, especially if you're dinking with a carburetor and you want to increase how much fuel is running through it to make it burn more rich, get more horsepower out of it. I mean, carburetors were fun to work on, but if you're working in an enclosed area, you're gonna crank out more carbon monoxide, and again, that's how some people used to die in their garages and so on. All right. Now the problem with carbon monoxide is that it has an incredibly high affinity to hemoglobin. All right, it's about 250 times more. It has a 250 times higher affinity to hemoglobin than oxygen. All right, so basically what I'm saying here is that carbon monoxide is 250 times more sticky than oxygen is. So, and being that it's so sticky that it interacts and binds with hemoglobin so tightly, it's going to be a lot harder to release it, and obviously we're going to slowly cause an inability to circulate and deliver oxygen to our tissues, and then which will obviously cause, this is a systemic problem that'll cause your body to essentially shut down. All right. So obviously that's why when people have carbon monoxide poisoning, if you get to a house where they have this, the first thing you do is you obviously throw a high flow oxygen mask on them and then take them to the hospital, and then use further oxygen treatments from there. All right, so that's an example of a chemical poisoning. Another example of a chemical injury is alcohol, and alcohol in obviously excessive amounts. I mean, being a weekend warrior, basically, i.e., drinking a few beers or partying, a couple of weekends a month or every weekend, doesn't get to this. When you see the word alcoholic, what we're talking about is a person that literally cannot function without the alcohol. I mean, their life revolves around the alcohol. It's more than just a chemical problem, it's a behavioral problem. All right. And you have to remember, it takes, years, decades to get to this point. All right. Now, normally, this is what a normal liver slide would look like. All right. This is what a normal liver slide would, a sample would look like. All right. So you see, this open area here. So basically, this is, kind of where these portal veins are located, and then you see these sinusoid capillaries all over the place in the liver. And liver cells are pretty boring looking. They just kind of tend to, all right, they're just kind of sitting there doing their thing. All right, but you get the picture. This is just a nice, normal-looking sample of liver tissue. Now, what happens when we metabolize alcohol? All right, when we metabolize alcohol, we wind up producing a lot of lactic acid and other metabolites as a result, and they can accumulate in the liver and cause severe damage. All right, and remember we're talking about ethanol, alcohol. All right. And obviously, what's going on here when someone is chronically pumping themselves full of alcohol, they're creating more of these metabolites than they can eliminate. So the liver is constantly spending all of its time trying to break down the alcohol. And then what happens here is that these liver cells start to die, they fall apart, and then you start to see a lot of cellular accumulations. So basically how this typically goes is you have the excessive alcohol intake, which tends to lead to hepatitis, and then which can lead to cirrhosis. All right. So then due to this excessive, like I said, this oxidative, this metabolic stress on the liver, and these cells die. This right here, this whiteness that you see here, this is fat. All right, so you start to see fat accumulation in the liver and in these liver cells, and this right here is what's called a Mallory body. Basically, this is a specific type of a protein accumulation that you see in the liver cells as well. All right, so basically now the cells that normally metabolize alcohol are called Kupffer cells. But basically, as these Kupffer cells, I mean, as they are unable to break this down, or as they spend all their time breaking it down, these Kupffer cells are going to die, hepatocytes are going to die, and then that's what you see here. All right, and then what else was I going to say to that? And then basically when a person, so basically, so it goes fatty, so the fatty liver, and then hepatitis, and then cirrhosis. Okay, so then basically you're going to see chronic inflammation of the liver, but basically as you keep this up over time, the liver is going to break down, and then that's when cirrhosis occurs. All right, and then that's when someone's going to have liver damage, they're going to get jaundiced. Then obviously this could potentially, well, this will eventually kill them. Okay, so that's just another example of a chemical agent that could cause cellular injury, and sorry about kind of the roundabout explanation there, but yeah, so kind of something to think about as well. This would also be, a direct injury. And of course the animations work now. Now when it comes to manifestations of injury, there's this, we already talked about the water aspect of this. So basically, with these hypoxic injuries, water can accumulate in cells and cause them to swell. And as long as we deal with the injurious agent, for example, if a cell if a tissue is ischemic, we restore blood flow. All right, as long as the cell membrane still remains relatively intact, all right, this is this can be a very reversible injury. All right, we just saw an example of lipid accumulation. I mean, that's probably the most classic example of lipid accumulation is in an alcoholic liver. All right, so if you look at cells that have massive lipid accumulations, you're going to see a lot of these white blebs or blobs of fat. All right. As these cells break down, fats are released and they accumulate. All right, carbohydrate accumulation, you tend to see certain disorders. I mean, for example, it could be long-term complications of diabetes and so on, which we'll talk about, later on. Same thing with proteins, protein accumulations. Excuse me. Can occur. Again, whether it's can occur from example misfolding proteins or improperly folded proteins, which typically tend to go along with genetic disorders, malnutrition problems, and so on. All right, pigments. If we see problems, a lot of this you see related with the skin. So, for example, I mean, when you suntan and you have excessive sun exposure to basically to the skin, what's going to happen is you're going to increase your melanin output, which obviously causes your skin to darken. But obviously that's obviously damaging stimulus, but that's how we adapt to it. Obviously, this can get out of hand, and that's how various cancers and other complications can form. Melanin is involved in other complications as well, but that's just kind of one of the more common examples that you run into. And obviously, a lack of a pigment, which would be the opposite of an accumulation, would be albinism. All right, calcium accumulations. So basically, we already talked about calcium accumulating and how it can damage the cell by activating enzymes that could damage the cell membrane, intracellular proteins like the cytoskeleton and enzymes, damaging the nucleus, reducing ATP production due to damage of the mitochondria. Calcium can also accumulate in areas of the body, like for example, the heart, and cause hardening of heart valves, which obviously cause disruptions in blood flow, could cause hypertrophy of the heart, and so on. But you get the picture here. So basically there are two major types, dystrophic calcifications and what's called metastatic. Okay, metastatic is just caused by generalized hypercalcemia. All right, which can be caused by overactive parathyroid glands and increase intake or absorption of vitamin D and calcium and so on. All right, an inability of the kidneys to excrete calcium. Whereas dystrophic calcification is what you see in damaged and dying tissues. The examples we were talking about earlier, where calcium accumulates in there. So again, this is the presentation on cellular injuries and injurious agents. Now, again, I hope, like the other lectures, I hope this helps. And the next one is going to be on cell death and some examples of cell death.